cervix decreasing, now endometrial carcinoma is increasing. Why? Lifestyle changes and lifespan increasing, more sedentary life, now patient become more obese, and it is related with the most three important findings. That is, those are nulliparous, and those are infertility, those are hypertension, those are diabetes mellitus, and obesity. These are the risk factors for endometrial carcinoma. Risk factor for so one of the important question of you is that what are the risk factors for endometrial carcinoma? So obesity, nulliparous, and hypertension, infertility, diabetes mellitus, all are related with the this endometrial carcinoma. So, and you know the polycystic ovarian syndrome, this is also ultimately may turn into endometrial carcinoma. Why? There is more secretion of the estrogen and no post-estrogen. There is no progesterone. Estrogen progesterone always counteract. But if continuously production of the estrogen, then it causes endometrial, very good, endometrial hyperplasia. This ultimately turns into endometrial carcinoma. So endometrial hyperplasia, one of the important topics for you. Just I will describe that endometrial hyperplasia. So that means, what is hyperplasia? So there is increase in the number and size of the cells. So how it is proliferation? So continuous production of the estrogen. So you for management you stop the production of the estrogen, and for regression of the other tissue you can supply the progesterone. Okay. So there is endometrial hyperplasia is two types, that is simple and complex. Simple is normal, what is the structure of the endometrium? It is similar to the normal pattern of the endometrium. So that is and complex. Complex means away from the normal and atypical cells and atypical structure of the endometrium, along with the abnormal nucleocytoplasmic ratio is increased. So atypical cell, atypical nucleus, and structure is also away from the normal. That is complex structure. There is a proportion of the glandular structure and stromal structure. So there is all things have becomes abnormal. Okay, more glandular tissue. Okay, so there is when usually what are the complaint of the patient when endometrial hyperplasia? What are the complaint? Irregular, irregular abnormal uterine bleeding, abnormal uterine bleeding due to shedding of the endometrium in different times, and if there is more glandular secretion, then what are the complaint? More secretion, more watery, more parvaginal watery discharge, more parvaginal watery discharge due to endometrial hyperplasia. Is there any pain? Yes, of course. There is, the secretion from the endometrial cavity. If from the any cavity, it will cause contraction and relaxation. So there is cyclical pain. There may be cyclical pain. And now, what are the diagnoses? Endometrial hyperplasia. How can we diagnose? How can we diagnose the endometrial hyperplasia? At first, from history, obesity, infertility, hypertension, diabetes mellitus, long time use of the tamoxifen. The tamoxifen tablet is given when? Tamoxifen when given? Breast carcinoma. Breast carcinoma, in the management of the breast carcinoma, tamoxifen is anti-estrogen. So it causes reversely endometrial hyperplasia. Last class I told the clomiphene citrate, mode of action of the clomiphene citrate is the same action of the tamoxifen. So there is a tamoxifen. So these are the factors for the endometrial hyperplasia. Obesity, nulliparity, then infertility, polycystic ovarian syndrome, and like this. So, from history, from risk factor, from investigation, how can we diagnose? By investigation, that is? No, Before tumor marker, you should think normal. So, always think normal way. What we do usually? Ultrasonogram. Ultrasonogram. সবসময় normal চিন্তা করবা। গতকালকে আমি খাতা দেখলাম তোমাদের প্রেগনেন্সিতে তোমরা MRI CT স্ক্যান সব লেখা রাখছো। এটা কি অ্যাকসেপ্টেবল? MRI CT স্ক্যান করা যায় প্রেগনেন্সিতে? তাই হিস্ট্রি রাইটিং সো ইম্পর্টেন্ট। হিস্ট্রি রাইটিং তোমরা যদি এই সমস্ত উল্টাপাল্টা কথা দেখো তাহলে তো প্রবলেম। ওকে, সো এই জন্য আমি আজকে ক্লাসে হিস্ট্রি রাইটিংটা ডিসক্রাইব করবো। আমি একটু সময় বেশি নেবো আজকে। আচ্ছা, তারপরে হ্যাঁ, আল্ট্রাসোনোগ্রাম ফাইন্ডিংস। সো তুমি যদি আল্ট্রাসোনোগ্রাম করো, নর্মাল এন্ডোমেট্রিয়াম থিকনেস কত? 8 to 10 মিলিমিটার ম্যাক্সিমাম। যদি এটা মনে করো একদম 3 সেন্টিমিটার হয়ে যায়, সো চোখে দেখা যায় না, সেটা 3 সেন্টিমিটার হয়ে যায়, তার মানে বুঝো কত চেঞ্জ হয়। হ্যাঁ, thickness of the endometrium is increasing and there is irregular surface of the endometrial cavity like this. So these are the ultrasonographic findings. Usually and we confirm by the, usually we should do the dilatation and curettage for histopathological study, whether it is complex, whether it is atypical cell, whether it is already turned into carcinoma or not. So histological diagnosis is must for the management of the endometrial hyperplasia. Okay, and now endometrial carcinoma. So ultimately, if it is untreated, if the endometrial hyperplasia is untreated, and ultimately it turns into endometrial carcinoma. So it is glandular structure, so adenocarcinoma is the common, adenocarcinoma. May be associated sometimes with adenosquamous cell carcinoma, and other clear cell carcinoma, so many types of the carcinoma. The most important is adenomatous carcinoma, as it is glandular tissue. Okay, so now now we can go to the, what are the risk factors? Risk factor is same as that of the endometrial hyperplasia, obesity, nulliparous, diabetes mellitus, hypertension. These are the most common factors. So there is symptoms. Symptoms are cyclical, maybe cyclical pain in the lower abdomen, abnormal uterine bleeding, maybe swelling. There is tenderness and some swelling in the lower abdomen. Swelling is not so common nowadays. It is diagnosed earlier when there is swelling in the uterine cavity, lower abdomen. When there is collection of the blood, when there is collection of pus, when there is collection of the water. If collection of the blood, what is called? Hematometa, pyometra, or hydrometra. So when it is associated with this, then then there is lower abdominal swelling, the suprapubic swelling. Okay. Now, what are the other sign symptoms? Other sign symptoms depends upon the complication of the endometrial carcinoma. Suppose it is give pressure on the bladder, suppose pressure on the rectum, or there is metastasis. So all things are related with the complaint or the symptom. And if there is comorbidity, suppose diabetes mellitus, hypertension, so all the symptoms or other symptoms are related to the comorbidity factors, that is patient complication, other complication if there is started. So endometrial carcinoma should be treated properly, not to be delayed. Usually what do you do? Patient is ignored, more than 60, 70 years patient, and they think that maybe there is menstruation going to stop and nothing to do like this. So there is delay in the management, and if 70 years they are somehow neglected in the family. There is no income, nothing, property, so most of the time depend on their son and daughter, and they are neglected. So all times they are delayed in the management. And what are the differential diagnoses? differential diagnosis is so common. Suppose there is senile ectopy. Senile ectopy of the vulva, vagina, cervix, endometrial cavity and other organ. So there is ectopy, so there is bleeding. Ectopy of the ulceration. So senile vaginitis, senile vulvovaginitis, or suppose ectopic endometritis. Ectopic endometritis, এখন কোথায় ছিল? প্রশ্ন কত কম ছিল? ক্লাসের কাছে কোনো ইম্পর্টেন্স নেই, বসো। So ectopic endometritis, these are the, so what are the differential diagnosis? Senile endometritis, ectopic vulvovaginitis, and sometimes in this age there is tuberculosis also. Endometrial polyp, you know the endometrial polyp, and tubercular endometritis. Tubercular endometritis also are the differential diagnosis. How can we manage? At first, we should need diagnosis, proper diagnosis by the from history. When you say the how can you diagnose the patient, you told the history, that is signs, symptoms, examination, and investigation. Okay, so here investigation is so many investigation are there is, but you should do specific investigation according to the possible diagnosis. Okay, so these are all are the same. And lastly, if ectopic cervicovaginitis or endometritis, what are the management? Most of the time there is in the menopause, these are the condition post-menopausal. So need hormonal replacement therapy, very good. So we should evaluate, we should need the hormone replacement and other management of the infection or according to the complaint. If there is endometrial polyp, what we do? Should need to remove by the dilatation and curettage. Endometrial carcinoma also. So what are the stages of the endometrial carcinoma? Same as carcinoma cervix, there is 4 stages. 4 stages. Suppose some basic thing is, if stage 1 is limited to the endometrial tissue, and stage 2 is extension to the glandular tissue and stromal tissue, stage 3 to the pelvic cellular tissue outside the uterus, and stage 4 is distant in bladder, rectum or other side. So and stage 1 is 3 parts, 1/3, 2/3 like this, invasion of the invasion of what? Thickness of the uterine wall. So these are the stage 1, 2, 3. Stage 2 is if there is glandular invasion, stage 2A, and stage 2B is when there is stromal tissue involvement. And outside the up to cervix and pelvic cellular tissue 3, and bladder, urinary bladder, and distant metastasis is stage 4. Okay, so all other management depends upon the stages also. And what are the others management? What do you think? Need surgery or no need? Surgery needed, na? But advanced যদি হয়ে যায়, on advanced carcinoma, then surgery is so difficult. You know the friable, how can you remove it? Is so much friable. And so most of the time chemotherapy, hormonal therapy, there is also radiation. Chemotherapy, there is also hormonal therapy by the progesterone and also radiation sometimes. And surgeries, but basically it is slow progressive. So stage we can find out the patient within stage 2. So most of the time stage 1, not so invasive, like carcinoma cervix. So you can do the radical hysterectomy most of the time. Follow-up, lifelong follow-up, and there is prognosis also. Okay, now we go to the history writing. History writing is so important in your clinical management, clinical classes. So in our department there is gynae cases and obstetric cases. So antenatal case, this pregnancy. तुम्हें molar pregnancy पढ़ना है? Molar pregnancy. Ectopic? আচ্ছা ওকে কি বলো আচ্ছা আচ্ছা ঠিক আছে শোনো আমরা পরীক্ষায় বা ক্লাসে তোমাদের যেটা দরকার প্রেগনেন্সি তাই না